Jane Carroll, this is just an authorization, meaning the new rules haven't taken effect just yet. But I did get some state politicians today to react and share their perspectives. Now, some say this will be a good thing for the state's economy. Others, though, worry that requirements will put more stress on those who are already vulnerable.
Those covered by Medicaid in South Carolina will now have to show they have a job to keep their state-sponsored medical coverage. Governor Henry McMaster applauded the launch of the new work requirements initiative called Healthy Connections Community Engagement.
In this kind of economy that we have right now in South Carolina, there's no reason for anyone who can work not to be working, especially if that person is able-bodied and is receiving public assistance.
Hello, how are you?
But candidate Jamie Harrison, Democratic challenger to South Carolina Senator Lindsey Graham, condemns the new rules.
It's very, very hard for folks, and particularly in low-income communities. It's hard enough just to make ends meet. And now to add additional requirements when people are down on their luck, it's just very, very difficult, particularly because everybody can't find a job.
To qualify for Medicaid, adult, able-bodied South Carolinians will now have to show at least 80 hours of monthly work, job training, education, or community service.
Hey, I'm William.
Visiting Greenville Friday for a small business roundtable, South Carolina Congressman William Timmons tells me he's in favor of the new Medicaid standards.
I think all Americans should contribute to the best of their ability, and if you are legitimately unable to, we need to take care of you because it's the right thing to do, but we also need to make sure that people are not freeloading.
Washington Administrator Seema Verma with the Centers for Medicare and Medicaid Services said this initiative provides a pathway out of poverty while still giving help for health care.
This program is very uniquely designed to help people provide the skills that they need, attach them to jobs that are available. What we heard from the governor is that you have one of the best economies that you've ever had, and there are employers that are looking for workers.
Now, it's important to point out that, according to the South Carolina Department of Health and Human Services, nothing is required right now. The state has just been authorized to move forward with this new initiative. Also important to point out, Medicaid applicants have to apply every year to continue receiving this type of health care coverage.